Coming to UNICEF, so hmm. so UNICEF was established in 1946 by the UN, United Nations, to provide emergency aid to children after World War II. World War II was a havoc. It created problems everywhere. So many of the organizations were set up post World War II. Again, the headquarters is in New York, United States of America. It is known as the United Nations Children's Fund since 1953, though the acronym of UNICEF is retained. Please remember this, this is very important. Okay. UNICEF stands for United Nations Children's Fund.
Ma'am, what is the full form of UNICEF, like if it is not United Nations Children's Fund?
Children's Emergency Fund.
Okay, ma'am.
Well, you don't remember that. इसी में confusion होता है. So now it is known as United Nations Children's Fund. Aim is to promote the survival, protection, and development of children and mothers, especially in developing countries. So, UNICEF works in India in many of the places, like for malnutrition. Also, UNICEF has identified hotspots, जहाँ पे बहुत ज़्यादा stunting या फिर क्या बोलते हैं उसको हाँ जो जो EAG स्टेट्स है एज आई वाज सेइंग द एम्पावर्ड एक्शन ग्रुप स्टेट जिसमें मध्य प्रदेश बिहार उत्तर प्रदेश फिर छत्तीसगढ़ भी आता है as far as I know. So these states which are performing very poorly in their health statistics, इन states को यूनिसेफ एक्स्ट्रा फंड देता है जहाँ पे चाइल्ड न्यूट्रिशन बहुत पुअर है तो ऐसे हॉटस्पॉट्स आइडेंटिफाई करता है तो इनका एक कट ऑफ होता है कि इतने बच्चे हुए इफ देर आर दीज मेनी चिल्ड्रन इन दैट पर्टिकुलर एरिया इफ दे आर सीइंग देयर इज टू मच ऑफ malnutrition happening in that area, there is too much of stunting being reported from that area, so they recognize that as hotspots, and for those hotspots extra aid is given in the form of manpower as well as money. So and जो भी एरिया में है सपोज इफ इट इज इन एंड अराउंड व्हेन आई वाज वर्किंग इन एम्स सो in and around Bhopal, so these hotspots were recognized and AIMS was made the the center for it, which was taking action. So all the aid used to come to AIMS, and AIMS used to send their people to those hotspots to check for the uh, malnutrition in those areas, why it was happening, to check if the ANMs knew, to check the knowledge of the ANMs if they were performing well or not. Anganwadis or the Anganwadis and the vaccination centers पे भी surprise checking होती थी. So and everything used to get reported and it used to be sent back to the funding agency, which was UNICEF. So this is what they are doing in and around India. So this was the major activity where I was involved of UNICEF. Okay, so the major areas of work again, immunization and control of childhood diseases. When we used to go to those hotspots, we used to overlook an immunization which was running. So immunization होता था and we were given क्या बोलते हैं उसको geographical locations. Okay, so we were given geographical locations, so वहां जाते थे, we used to mark the geographical locations on our map, and then we used to rate the ANM, and then we used to have an interview and check the knowledge of the ANM as well. So immunization and control of childhood diseases, nutrition programs, promotion of breastfeeding and prevention of malnutrition, safe water supply and sanitation, basic education and girls education, basic education for both boys and girls, and majorly dealing with girls education because girls are less catered to by their family, and child rights advocacy and protection. So these are the major areas of work of the UNICEF, basically working for the children. So it partnerships with WHO, government, the other NGOs and local communities in order to fulfill its own priorities. So the iconic programs of UNICEF is GOBI, Gobi Triple F, FFF. So I'll deal with the Gobi FFF in details further in the further slides. So basically the motto of UNICEF is for every child, every right. If you can remember this, for every child, every right. Okay. So the content of services, we'll deal with it in details of UNICEF. So first is child health, supports production of vaccines and sera globally, assisted India's BCG vaccination and penicillin, DDT and iodized salt plants. So it gave aid to combat these plants. Promotes environmental sanitation and safe water in rural areas. If there is no tap water available, they teach them how to store water, how to harbor groundwater, and how to sustainably use water. Focus on primary healthcare, immunization, maternal childcare, family planning, safe water, and sanitation. Because taking care of these things solves more than half of the problems. And it also encourages community participation through local health volunteers. So many of the local health volunteers are working for UNICEF at the grassroots level. So people are more likely to listen to volunteers who come from among them. Like if we as external people, if you as medical student or we as doctors, if we go into the field and tell them to do something, they will less likely follow it because they think of us as an external agency. But if somebody from amongst them, if they come as volunteers and then we train them and then they go and impart those health education to them, they are more likely to adopt it. So it encourages community participation. Child nutrition. So this was child health. Now coming to child nutrition. So it prioritizes improving child nutrition, promotes low cost protein rich food and applied nutrition programs with the Food and Agriculture Organization, which is the FAO, aided dairy plants across Indian states. Vitamin A supplementations, as we have seen in the vitamin A supplementation program, iodized salt, iodization of salt, iron and folate supplements. They are all the interventions which is done by UNICEF and support national food and nutrition policies along with FAO and WHO so that there is no poisoning. The substandard food are not uh, given to the children. Okay, so child health, child nutrition. As we have also in the initial classes, we have dealt with this IYC. If anybody remembers the full form, IYCF, anybody? If you give very good vibes, they might ask you this.
Infant and young child feeding.
Yes, infant and young child feeding practices basically they have a set of indicators again given by UNICEF itself. So, according to those indicators, one has to judge if the child is taking proper nutrition or not. So, if you can remember under child nutrition, so IYCF practices are given by these guidelines are set by UNICEF. IYCF practices, infant and young child feeding practices. Okay. So child health हो गया, child nutrition. Coming to family and child welfare, improves child care via parent education, daycare centers and women club. So women clubs are set where women are educated about how to feed the child, what to feed the child, in what quantity, in what frequency, and what should be the consistency of the food according to the month or the age of the child. To put it nicely, according to the age of the child. So they promote family and child welfare as well, integrates welfare with health, nutrition, and education programs. So, all these health, nutrition, family welfare, the education which is being imparted to the women and the parents of the child, everything is integrated into one. Education, both formal and non-formal. It works with UNESCO to enhance science and science education in India. It provides labs, tools, books, and audiovisual aids at the schools, various schools in the villages. Focuses on practical environment-based education for all children. So UNICEF provides aids here as well. So not only to core children as a whole, even to the schools. It also helps at the school level by providing labs, books, tools, audiovisual aids. Okay. So this is the functions of UNICEF: child health, child nutrition, family and child welfare, education, both formal and non-formal. So as I was saying, the flagship program of UNICEF, which is the GOBI Triple F, GOBIFFF. So G stands for growth monitoring using growth charts. So basically, regular measurements of a child's growth, which is weight to height, to detect malnutrition very early on in life. So regular monitoring to the WHO growth charts. Oral rehydration therapy for dehydration. So it basically prevents and treats dehydration due to diarrhea, which is a major cause of child death. I will share a personal incident of mine in one of the PHCs. It was not a there was a PHC there, but I was visiting through a camp. So I held a camp there. So there was a news that a 2-year-old child had died due to diarrhea. So what the parents were doing, this is because of lack of health education. The parents, they used to go to a quack and then the quack used to give some injection to the child, and the child for 3-4 days यही हुआ, इंजेक्शन लगा लगा एंड ऑन द फोर्थ डे द चाइल्ड पास्ड अवे. सो सिंपल ओआरएस कुड हैव प्रोटेक्टेड द चाइल्ड और प्रिवेंटेड द डेथ ऑफ द चाइल्ड. तो अंडर 5 ईयर डेथ हुआ था उसमें. सो सच बेसिक थिंग्स विच आर लैकिंग इन द सोसाइटी. सो ओरल rehydration therapy for dehydration and promotion of breastfeeding. So exclusive breastfeeding is to be promoted for at least how many months?
6 months.
Yes,
6 months.
EBF for 6 months. And what is exclusive breastfeeding?
Ma'am, nothing apart from breast milk is given to the child.
तो
Unless some medications are going on.
unless,
Some medications are going on.
ओके, तो पानी दे सकते हैं?
नहीं मैम.
ओके, गुड, ठीक है. सो इफ अभिषेक, ऐसे इफ अ मदर कम्स टू एंड सेज कि बच्चा तो प्यासा है, माने थर्स्टी है, तो बस ब्रेस्ट मिल्क से कैसे होगा, पानी तो देना पड़ेगा. सो व्हाट विल यू टेल द मदर?
99% ब्रेस्ट मिल्क तो पानी है तो उससे प्यास बुझ जाएगी.
Yes. You can say that breast milk covers both the thirst and the hunger of the child. So, hind milk, fore milk, have you read all that in pediatrics as of now?
Ma'am, we read in comment. That is, I read in comment.
Okay, okay. So you guys know the concept of hind milk, fore milk, and all. ठीक है. So you have to tell the mother, you have to counsel the mother one very important thing, that she should empty one breast entirely before putting the baby onto the other breast. This was B. So going to I. I is immunization against measles, diphtheria, polio, pertussis, tetanus, and tuberculosis. So GOBI, growth monitoring, ORS, promoting breastfeeding, and immunization against the mentioned diseases. Okay. So then I told about FFF. So what is FFF? किसी को पता है?
Female literature, family planning,
हाँ.
or food supplement.
Yes, very good, Maranisa, very good. Female education, then family planning or family spacing, and food supplementation. Okay. So educate, female education, basically educating the girls and women, which if the female is educated, she is more likely to adopt to a healthy behavior and listen to the doctor, as since she is educated, she'll be better able to understand the thing. So promoting health, promoting education for both the girl and the women. So in order to promote child health and survival outcomes of the child. Then family spacing. So if adequate family spacing is there, that adequate space is there between the two births, so both the maternal and child health are protected. In that case, both the children, they get equal attention and nutrition from the mother, and the mother also stays healthy. So proper family planning or family spacing between two children. And food supplementation. So ensuring adequate nutrition for both child and the mother through food, if the natural. So again, urban basic services program focuses on improving health, nutrition, water supply, sanitation, education for both women and low income children. Just a second. Low income children coming from low income family. Objective is to enhance child survival and development in poor urban communities. Third one is broader UNICEF activities promotes child survival, protection, and development. Key intervention like immunization, growth monitoring, diarrhea management, safe water sanitation, birth spacing, education, women's income activities. As I was saying, GOBI triple F. Works in partnership with WHO to support primary healthcare implementation globally. So WHO and UNICEF, they go hand in hand because both of them are dealing with children and women as a whole. Okay, so UNICEF is done.